Announcement of action taken in closed action as soon as party.
Volleyball girls varsity stipend position with high. What's it called? Amber McCovey. Football varsity head coach stipend position with high. Floyd Billings III. Fifth grade teacher certificated. Elementary Craig Merritt. Fifth grade teacher certificated with elementary Sarah Isbell. Track coach stipend position with Valley High. Benny Green. Literacy professional classified Orleans Elementary transfer for Joanne Campbell. Literacy professional classified position Orleans Rena Gibbons. Tuscarora Solutions facilitator stipend position at Ruth Elementary and West. PBIS site lead stipend position with Elementary Margaret Peters. Tuscarora facilitator coordinator stipend position with Elementary Ty Weber. PBIS site lead, stipend position, Trinity Valley Elementary, Broadport. PBIS team member, stipend position, Trinity Valley Elementary, Sheree Rosler. PBIS team member, stipend position, Trinity Valley Elementary, Dina Mold. PBIS team member, stipend position, Hooper Valley High School, Natalie Scott. PBIS team member, stipend position, Hooper High School, Michelle Johnson. PBIS team lead, stipend position, Hooper High School, Gerald Soho. AD head football coach, stipend position, Hooper High School, Bob Gordon. Three resignations, one certificated, two classified.
Next thing is public comment. For this portion of the meeting, members of the public may address the board on matters not on the agenda. Such matters are within the subject jurisdiction of the board. Members of the public may address the board regarding items on this agenda immediately prior to their being discussed by the board. Time limits generally 3 minutes per speaker, 20 minutes per subject. Will be imposed by the board president. The board president may rule on the appropriateness of the topic. The topic will be more suitably addressed in any time when it should be presented. The board shall not permit the public criticism of its policies, procedures, programs, services, actions, as outlined in Government Rule 5.95. In addition, the board did not permit the public criticism of this. Whenever a member of the public initiates specific complaints or charges against human employees, the board president shall inform the complainant that in order to protect the employee's rights to adequate notice before a hearing of such complaints and charges, will also serve the ability of the board to legally consider the complaints and charges and any subsequent evaluation of the employee. It is the policy of the board to either such complaints or charges in closed session, unless otherwise requested by the board president shall also encourage non-agenda public comments. So, Roberta, Each speaker will have be limited to 3 minutes to questions on the clock.
Okay, so I'm here to address the board today about the safety of our children here within the Climate Community or Unified School District. My first question is, I would like to know who is a part of the safety board that puts together.
This is your time to tell us it's not a power law.
Okay, well, I would like to know that I believe as the parents have the right to know who is making decisions for our children's safety. I'd also like to address Ms. Jennifer, the superintendent. I know that community member, my grandmother, has asked these issues and has been times. We are a Native community. We are unique, and the disrespect to an elder in that way is very disheartening. And I just want you to be aware of that. I have a child who is very, he has asthma. So if he were to get COVID, it would be very devastating for him and hospitalized multiple times just due to this smoke. And I'm very concerned. I'm a concerned parent. I am not in favor of your little chart that you guys created. We are, like I said, we're a unique community. We are a Native community. We have different health issues. We have different statistics when it comes to our children, our people, and how they're affected by health crises such as this one. And I just really wanted to let you know that the parents want to be more proactive and want you guys to be more transparent. I am very, very upset with the loss of Auntie Brown. I felt safe with her here. I felt like she was making some very smart moves for our community. She was very beloved by staff and community alike, and to lose her is huge. And I do not feel safe sending my kids to school with what you guys have in place right now. Shame on you. Shame on all of you. Our children need to come first. For instance, this room.
3 minutes.
I'm going to finish what I have to say. This room. You guys, people in this room, you guys could have moved this meeting to the gym. I'm not going to stop. I'm not going to stop. You guys have our children in little rooms, but you care for your own safety more than you care for our children. I am going to finish.
You have the right to call anyone who board members. But you don't respond.
There has been no response to our request. That is why we are here speaking. I will let my sister and my aunties and my family speak, but I will have my say.
So I come here as well as a parent and a community member. I guess I want to take the approach of that we know CDC guidelines are constantly changing, they're always evolving, but maybe we jump in this prematurely. Maybe we even the parents need to feel safe. I mean, we're all taught in this education for safety, and seeing the staff over there and hearing the things that are going on over there hearing the stories from your children is concerning. I mean, that we have this flow chart and we are using it, but it is absolutely reactive. It's not putting anything in place to prevent any measures from, exposure. Kids can't get a vaccine until the age of 12 or older. What are we doing for the little, how are we safeguarding them more delicately because they are a most vulnerable population? I just feel like you guys need to take the extra measures to make us feel like that you guys are 100% on the same team as us, and that community and staff input is important. And I mean, there's really nothing more that everyone else hasn't said that I can add to that, but I think that we have to come together. It can't be you guys versus us. It has to be all of us together trying to improve. You guys take care. That's all I really wanted to say.
I'm here on behalf of my day, my teaching day today, for feedback. And my first request is that we get a COVID supervisor or someone who's designated as a COVID go-to person for our large school, the largest school in the district. And I feel like right now, my alternatives are limited to the caseload that my principal has being the principal of such a large school. He told me that he is the person that I need to call and contact with whenever. Well, this morning, a student came in, standing outside my door. Got breakfast, served breakfast, he wasn't eating. Closer evaluation, I asked him what was wrong. He said, I waited till sunup. At sunup, I threw up. But my mom made me come to school. So then I noticed he still wasn't eating, because sometimes it happens that kids will come around. He wasn't interested in food. I was outside on the playground because we were told to feed our kids in the classroom. I'm taking my kids out to the picnic table. So I'm out there, there's no phone, and my kid's eating. Called the guy out on the playground, he brought his cell phone, he started calling the office. Finally, we got the child removed, taken somewhere. Got back into the classroom, started our work. He comes in, back into my room. 20 minutes later, he vomits all over the table on the floor. So at that point, I have all the kids get up, walk out, line up on the yellow dots that are spaced, go on out. I start calling the office what to do, and the child, no one's answering the phone. My principal on his voicemail says, I could always just email me if you have any questions. Another child said, well, my sister threw up in the sink this morning. And my dad's taking her to the clinic to get a test. And I said, later on the day, I went back and punched him again, thinking, well, maybe that happened this weekend. He goes, no, this happened this morning. My dad had to take her to the clinic to get a test. And I said, so is your sister in school today? Yes. I just, yes, everybody. And still, I don't know who to talk to about this. But how do we as teachers, we're not allowed to call parents or get the word out. I don't know as a teacher what to do, who I can call, who I can depend on, who can help me. The staff is limited at the office because of COVID. So that was my day. And it's real. So whenever anybody comes to you and says everything's great, we're all doing good. We're not.
Thank you. Sandra?
So when I came up here earlier, one thing that I wanted to say that I didn't say because I was under the impression that the kids went to be at in the classroom that I learned today that they are now. I was reading the California guidelines and it states that the
several layers of mitigation factors that are in place. So the biggest thing that's on the website is I just said, well, then both of students who are not fitting into that category. So their biggest safety measure that is masks. And it's understandable that we're going to have to do something in lunchtime because they take their masks off. Assign seating so that we can have that trace that are around. And we need to be able to structure this better than just letting it. And it's very upsetting. It's hard to control yourself and not let your emotions take hold. I know that most of you are parents. I know we're all over, we're all have stuff on our shoulders that are more stressful than we've ever had. But we can't keep this. We can't keep making mistakes. We need to be proactive. We need to get ahead of things. If I guarantee you, when a child gets definitely the one that gets the whole community attack. They're going to attack you guys. We're just going to protect each other.
Which one does it say? Sorry, I give you two. Okay, how's it going? I just wanted to remind the board that we did have a relationship agreement that included an opportunity for PTTA to present at board meetings. And I've noticed that our ability to present has been removed from the agenda. And so we would like for that to be reinstated as soon as possible. We have had a long history of having presentations. So I appreciate the opportunity to speak and give a report, at least at the next meeting. We are excited to let you know that we have ratified our agreement that you guys probably discussed in the session. We still have some work to do on the bargaining end. One update that I would also like to just remind the board is that when there are sunshine agreements, that we expect to be able to bargain on all of those issues. This year, kind of went over to last year, it's spilled over to this year. But we have come to standstills in bargaining where they're just like, we're not willing to talk to you guys about any of that. And that's usually not how bargaining works. Usually there is an opportunity to discuss the areas of the contract that they have sunshine for. And you guys all had a copy of that in February of 2019. So we have not been able to bargain on all of those things. And we basically were told during an impasse session that these will be only things that we're going to talk about. So we want to hopefully correct that in building this positive relationship with the board of district. Also, we would like for there to be a policy, or I would like to have research into a policy, if one already exists, about the amount of time that it should take to get correspondence returned. So oftentimes, and I think it was voiced in the public as well, that we will request information, or we have several people waiting for approval on work that was done outside of contractual hours, like work that was asked for people to do, to show up, and and we haven't been able to even get a response to this, other than it has been received. And I am one of those people. So there should be a statute, a time statute of limitations, something that's says that you have to be your communications need to be responded to in a timely manner, because it makes it really frustrating for people and supporting people who are asking me to do something and then I can't make any way to return communications. There is one last thing that in the Keenan trainings, I noticed that there was mention in the training of the IIPP, the Injury, Illness, and Prevention Plan. It says your business, office, or your district office will give you a copy of that plan, and we did not receive one. So if that plan exists, we would like to have a copy of it to complete that training.
Your other item.
Yeah, so I think I mixed them together. So I think that there was,
Hard to tell.
so one of them was communications.
Responsive communication driven was not a
Okay, so I think that I just mixed them together. Yeah. Kim, do you have anything that you wanted to share in this one? Okay. All right. Thank you.
Deacon Harris.
Hello, my name is Deacon Paris, and the letter that you guys received just a day ago, I was asked to read what were the 3 minutes that I have. It has been brought to our attention that, and this letter is from the tribal chairman and tribal council supported it. It has been brought to our attention that longtime district nurse Angie Brown has concluded her employment on September 3rd, 2021. We had the opportunity to include a copy of Mrs. Brown's submitted letter of concern dated August 30th, 2021, which shed light upon community justice unified school district COVID-19 protocols that have serious implications on our population. After further review of the Hoopa school safety plans that were submitted to myself and the Hoopa Valley Tribe's Office of Emergency Services, OES, on August 24th, 2021, we are concerned that the documents provide lack of detail of procedures and protocols and site-specific design for each school. We are further concerned that this unfortunate circumstance typifies a disconnect between Climate Trinity Justice Unified School District and the needs of our community, which culminates in a trend of losing the most invested personnel within the district. And she has been visible, meaningful connections, and arguably is more than required by her job as a trained public health professional. But perhaps more importantly, advocated for our children and families. Therefore, it is upsetting to see her leave her position in the district. We would then hear her questions: who will do the work that she has undertaken out of her vested interest in our children, and who will do the work that her invested interest in our children and community? What assurances can be provided that demonstrate the stringent safety protocols and practices will continue in her absence, and what was done to encourage her to stay? The difference that constitutes uniqueness for our community that have been the guiding principles for how the Hoopa Valley Tribe's COVID-19 protocols have been formulated, those rest on the virtue that we cannot afford to lose any of our community members to coronavirus and its variants, especially our elders. We are not concerned that the district is making decisions for the safety of our kids based on county or state norms and policy that overlook culturally responsible approaches. It is pertinent that the district further consultation with us on these protocols because of the potential for schools to become a place that compromises the safety of our current and future generations, which may continue to hold at the forefront of our COVID-19 mitigation efforts. Our OES and public health orders continue to adjust to appropriately reflect the most current community development. Compliance with such orders within the exterior boundaries of the reservation is vital to the sovereignty of the Hoopa Valley Tribe.
Have open a public hearing. Pardon, do you want to-
Well, this is a form for public disclosure of proposed collective bargaining agreement. The 1200 requirement that a school does has to provide notice. Tonight we are, our proposal is for a collective bargaining agreement amount of $739,046.69, which the total percentage change for the average represented employee is 14%. The AB 1200 consists of the 2021 school year. The district shall make a one-time payment to all bargaining unit members employed by the district as of August 3rd, 2021, of 2,208 per unit member. District retirees who retired at the end of the 2021 school year shall also be eligible for this payment. For the 21-22 school year, a 2% salary increase to the PCTA members. Confidential, a 2.3% salary increase for placements on a restructured confidential salary schedule consistent with classified. For health and welfare, for the 2021 school year, the district shall provide a one-time off-schedule stipend of $2,500 to all bargaining unit members in recognition of the increased cost of health and welfare benefits. For the 21-22 school year, the district shall provide a one-time off-schedule payment of $2,160 to all bargaining unit members employed by the district as of August 23rd, 2021. In recognition of the increased cost of health and welfare benefits, district employees hired after August 20th, 2021 shall be eligible for a prorated payment based on their date of hire. Unrestricted resources will be used for the salary schedule increase. Restricted resources will be used for the one-time payment for salary and health and welfare benefits.
We did not have an easy time bargaining for a 2% raise on salary. We were told several times that it was kind of impossible to get that, and I appreciate the ability to kind of come to that number even though we asked for 3. I'm just wondering, with the restructured salary schedule to the confidential employees and the 2% to a 2.3% increase on top of that, what does that salary schedule look like? What is the increase to the salary schedule look like? So like say, for example, if you have, what is the range? Because I can tell you like a 2% increase to a new employee for the KTJUSD salary schedule, it's about $40,000. So it's like $800, kind of a thing. And the upper end, it's about $75,000 to $80,000. So it's like $1,600 annually. So what kind of increases are we looking at for the confidential stuff?
It averages out to be a 2.5%. Percentages of all of the 2% of that is not the same, not the same.
So out of the $739,046, the confidential would be including statutory is $26,000.
5 employees.
So 5 employees, so that's about $5,000 increase per employee with statutory benefit. A little over. So I guess that what we were hoping for is that bargaining can be done in an equitable fashion. And I know that it's hard when you're bargaining for 5 employees versus 80 employees. But we want to make sure that we're sending a strong message that we value every single employee to a certain equitable way. And I know that there is more days on that calendar. I understand there's more hours on that calendar as well. But to have that extreme difference is pretty disheartening for us.
One of the reasons is the same as the classified salary from 6 or 7 different salary schedules. And so what we did was classified, so same as classified salaries.
But what are the salaries for a classified employee? I mean, we're talking what's the lowest salary for a classified employee on that salary schedule? So 2.5% on an $18,000 annual salary is really low. We have 20 steps and 5 columns. And those are all earned by taking units.
At school year.
It's about 1.5% per movement in column. Or right, per step, and movement in column is about 2. But I mean, we have to take 15 units to go from one column to the other.
Confidential salary schedule really, once we settled with CSEA, we done the salary schedule for like a year in the making. CSEA's salary schedule, probably 3.5% between ranges and steps was retroactive to January 1st. Confidential salary, we retroactive. So it's really, there are some subtle differences, like the cluster that was 2.3, not go back further. So if had that happened, cross training, and so all are on the same salary schedule, and giving them some same as the last time, some went up, some went off. It's not. Hopefully from here forward, it's all squared and all of. So we should have someone.
I feel it's just disheartening to know that we had to go all the way to impasse and have, you know, a non-biased participant to get us even anything that was going on to our salary schedule. And, you know, hours and hours and hours of bargaining, and probably thousands of dollars in legal fees because your the superintendent doesn't bargain for the district, and the lawyer does. And so just a ton of money that is being wasted, and to feel like, you know, our average with a 2% increase for our members is $800 to $1,600. And to see such a big difference is really disheartening.
Right, mine was $124 a year. That was my goal. Right, maybe 1,200. Questions? Seven, in bringing into consulting, facilities and finance presentation.
Thank you to the board. I'm here and I have a couple of items, I guess. The first item is I just wanted to put a little bit of an update on the facility. We had a lot of conversations last meeting. I want to let you know that further conversation got some clarification, got the process. In the interest of time, I'll get all the details last time. I'd like to perhaps come back at the October or November board meeting. More detail on the financing. With that being said, last week we also discussed the financing of the general obligation law. And I believe that is the next action item that is on the table. And I would like to just present all of you documents. But if there's any questions about the facility side of the I think it was positive. We're all trying to navigate the complex rules and nothing new in that process is done in the back. And so we're getting kind of feedback and synchronizing the entire team. I will say that I believe this was the first time we've had a new architect on board, people as well. So it allowed us to clarify a lot of timelines, allowed us to clarify a lot of opportunity options. We want to evaluate those and actually see has some homework to do back to us. We have some homework to do to get back to them. Once we've done that, we kind of build our thought process We will. I can tell you now, it will not be as large as it is. Up to 12,000 feet, I do believe that the structure will be functional. Be able to put a program and be able to do that in a defined way. Perfect. And I will move on to discussion of the items for the general obligation bond or funding. We didn't get a lot of time to go into depth on this last one, but the district has in the past, refinanced the general obligation bond. Reduce the duration of the debt that's outstanding and pass savings along to the taxpayers. General obligation bonds are supported by an ad valorem or value-based tax on all taxable property. These bonds in turn utilize that to receive that tax fund to repay the investors. We're now in a position where a combination of things are going to allow us to materialize some pretty meaningful savings. Those savings do not unfortunately go to your general fund, they go back to the taxpayers and support these bonds. But it is the district's fiduciary duty to do so. Taking advantage of one. With that being said, the district has actually 3 series of bonds that are outstanding finance. One series is a little bit of the negative leftover for finance. And there is one new series for the 2016 election, and also the second series for 2018 election. We talked about this last time and demonstrated how over time we have a shorter duration of bonds. Mortgage might start out with a 30-year mortgage. After 15 years, we have a 15-year. Might refinance at that time, take advantage of lower interest rates on the shorter duration bond. Something very similar to what we're doing here. Overall, we talked about savings being in excess of $400,000. I would like to say that the markets have built up recently, and the markets only up will be well in excess of $400,000. I think it's safe to say we'll double that number. Might even be a little further than that, but I don't want to think that because we know that markets move up and down. But it will certainly be very good savings. I think comfortable with the state in the last 3 months. With that, we discuss the process. According you have a resolution to tonight. That resolution authorizes the sale of not to exceed $8 million aggregate principal amount of general obligation funding bonds. That resolution also spells out the terms and limitations on such bonds. And as well, we approve certain past performed documents. In fact, there are several agreements that go with each of the bond issues that we have over time. In this case, we will be approving both the resolution, and by approving that resolution, we'll also be approving the format of your bond purchase agreements, your escrow agreements, and your preliminary official statement. Each of these documents is typically generated into your bond sales. You will notice that the resolution, while it is complete in its format, there are blanks to the documents. Those blanks are there for a good reason. We have not set the interest rate on the bonds yet. We don't know what the final numbers are. All of these blanks are filled in as we go through the process. Bond purchase agreement, which is the other resolution, is the agreement between the district and the underwriting bank, which is purchasing bonds for the district. You will note that there are 3 such bond purchase agreements that we are refinancing potentially 3 series of bonds. The next agreement is the escrow agreement. You'll notice that there are 2 of those, and that is for the 2008 Series B and the 2016 Series A. This is the agreement with the bank that services the bond, the same bank that we've been using. Traditionally, actually, it was Humboldt County providing this service. They are in the process of transferring that over to the bank for all of their accounts. So this will be between the district and the bank of New York Valley. And this essentially spells out what is done with the proceeds of refunding bonds, how they are applied to repay the previously issued bonds. Once those previously issued bonds are repaid, they are no longer an obligation to the district. They are replaced with the 2021 refunding bonds. Most importantly, I think is, at least in my opinion, is the preliminary official statement. The thickest of the documents you have in your packet. Lots of links as well. This is the authoring document that investors will consider. Why do I consider this a very important document? It is governed by security of these things. Well, you have obligations to make sure that this information is accurate and up to date. To that end, some of these blanks also include additional information for unaudited actuals tonight will be utilized that information. This document, in fact, this document will be updated throughout the process until such time as we sell the bonds. Make sure we are compliant with all of the one additional document that we have included in there, what we call the G17 letter. And that is the final of the document. It's not actually required to approve that document. It's more of an information document provided by your underwriter to spell out their confidence in interest as required by the security statement. But with all of those documents as attachments, the resolution that approves, authorizes the completion of each of these documents through the process by staff. And I think that answers or sort of covers all the staff. Are there any questions about any of these documents and concerns? I'm just happy to answer them at this time.
Our audience, like the bonds, on that.
Certainly.
So how much we spend on the state, how, maybe just a little background.
It is. And for a little bit of background, the district has approved two general obligation bond measures over time. 2008, to begin the modernization project of the school, authorized, I want to say about $6 million worth of bonds at that time. The second was in 2016, that modernization project. Those roughly in total, I think, $12 million of bonds issued have been leveraged and utilized to provide the funds necessary to match funds that you receive from the state, and also been used to put the district into a large position as far as you have a certain number of indebtedness utilized as a district. And in doing that, it's raised the district well over $80 million of state funding. That may be able to show on that player the $80 million. But it is all part and parcel of the efforts to modernize and back in 2008. 2017, we actually refinanced that first issue, 2008 Series A. And today we are refinancing subsequent portion of the same general. But to be clear, it is a resource that is used strictly and solely for facilities purposes. Technically cannot use bonds for general fund for all purposes. And the general obligation bonds, they're not a general fund obligation, they're supported by the tax base. And by refinancing these, you will lower the tax rates, levying on the tax members. Anything else that you would like me to cover?
Take opportunity. So we have 80 million, we received over 80 million state to redo our facility. District owes net 6.1.
At this point in time, it is 6.9.
What the district owes contrary to other companies. But in that whole redoing our schools, our air conditioning, our heating, HVAC, what we call it, is the most updated system. And our schools are in better shape than 90% of them in the state. And with COVID, we have the ability to change the filters. So it's the most modern that we can have, and our facilities, like I say, are better than about 90% of facilities in the state. So,
We a lot done with the two bond measures, state money, also some grant money and other resources of the district that was put into this as well. to really kind of bring it up to speed. Many times these matters of maintaining facilities get ignored as other pressures come to the forefront, especially during about the last 15, 20 years with the Great Recession and the negative revenue limit factors that you had to deal with to constrain your operational stuff. Many times you are forced to keep the focus on what's going on in the classroom and ignore the facilities. So there was a lot of deferred maintenance and catch up that had to be taken care of. But I think it's safe to say that today, I believe every single campus has been touched and had repairs or modernization done to the majority of the buildings throughout the district as a whole.
We have two wings, one at the high school and one at Trinity Valley that have
Still
not been touched. Yeah. Question next.
Yeah, I just had a quick question with regard to the, you said that the debt is close to $7 million. What's the repayment on that debt though? Because I think that's what you said something about contrary to what Facebook believes, but I think that it's like when you have a debt, there's a payment cost, right? So is the total payments that we have to make, will that total the 6.89 or will there be?
No, the 6.98 is the principal amount, and what we're specifically speaking about is a certificate of participation, which if it is not repaid, the state will take back money that they've given you previously. So with regard to that 6.9, not part of this deal bond process that we're discussing right now.
Exactly,
It's okay
but
with
it's finance and that's,
if it's okay with the board.
yes, it is.
Okay, and I will continue because it's not exactly on topic. But with regard to that, and what we talked about at the last meeting was that we are making efforts in combination with this and with other activities to repay that 6.9 because to the extent we don't, we have to repay the 6.9 plus the interest due on it, plus the state will take back an equivalent amount from the district. We're trying to avoid any take back that we can or minimize the amount. So that's kind of a separate topic for this.
Okay, I was just wondering, just because there was like that comment about like, well, people think it's a larger debt. And I think that people think it's a larger debt because we actually have to pay a lot more money to pay off the 6.98
To the extent.
with the interest,
To
because
to the extent that it goes to maturity, yes, but again, we're trying to prepay. So sort of like what we do with these deal bonds, when we refund them, we don't have to pay all the interest that would be. We only pay the principal that's outstanding on the date that we refund them. All the other interest goes away. Why do these refunding bonds work? Lower interest rate today means we pay a lot less than interest over time if we refinance them. We're probably going to do something similar with what remains of the COP as well. But we're a little premature, so I would like to come back at the October or November meeting
Yes.
to go into all of those details. We start mixing the different debt types and get really confusing.
Okay, thank you. I just kind of wanted to clarify some of that. Okay, back on topic here, did you have anything else or are you ready for the board to act?
Unless the board has additional questions, I'm prepared
I'll
for that.
entertain a motion to approve resolution 2213 authorizing the issuance and sale of not to exceed $8 million aggregate principal amount of general obligation refunding bonds. As to form an agreement is approved via the resolution, the items 1 through 7 under that. So I'll entertain a motion to approve that.
I'll move to approve the resolution.
Okay, Tom moves. Is there a second? Rob seconded.
No, Rob.
Oh, Rob moved in.
I'll second.
Okay, any discussion? All in favor, say aye.
Aye.
Opposed, nay. Motions in that unanimously approved. Okay, we'll go to.
Thank you, Shannon.
Thank you, Shannon. We'll go to item 8B. Resolution 2214, Plymouth Trinity Joint Unified School District local assignment notification. Want to ask about the reason.
I've got clarification.
unaudited.
Yes.
So do I think the whole, I guess the one that's access to both now. I'll think the whole topic right now.
He's gonna abstain from the discussion.
Because I haven't audited one of them. So I. So 8C, one of them.
Okay, do I have a motion to approve the resolution 2214 KTJUSD local assignment notification?
I'll approve.
Rob moves, is there a second? Deb seconds, discussion. Please help. Anything you want?
No, just, if there are questions about, what we've done this before. It allows us some flexibility with signing teachers. Because we have a necessary small school, we have some flexibility for the board to approve a position that otherwise the teacher would not be eligible to teach.
Any other questions from the board? If not, all in favor, say aye.
Aye.
Opposed, nay. 6 yeses, 1 abstention, motion carried. Next is the approval of the 2021 unaudited actuals. This is an annual requirement of the board. California State Education Code requires the governing board of a school district approve the unaudited actual report for the previous fiscal year. The 2021 unaudited actuals are a very detailed look at the district's financial activities for the fiscal year. Our independent auditor will review the unaudited actuals and prepare the final financial statements to be approved at the January board meeting. Do I have a motion to approve? Martha moves. Is there a second? Davey seconds. Discussion. I thought this is a very good document if anyone wants to look at it, how money was spent this past year. If there's no further discussion, we will vote. All in favor, say aye.
Aye.
Opposed, nay. Unanimous, motion carries. Okay, the next is resolution to adopt the GAN limit 2021-22. This is an annual requirement of the board. In 1979, Proposition 4 was passed creating the GAN limit. The intent of Prop 4 is to restrict government agencies from increasing the size of their programs as a result of excess tax collection. I'll entertain a motion to approve.
Second.
Carrie. Carrie moved, Deborah seconds. Discussion. No discussion, all in favor, aye.
Aye.
Opposed, nay. Unanimous, motion approved. The next item is a stipend for a school psychologist intern. To approve an annual stipend of $15,000 for individuals qualified to file a school psychologist intern position. The need for school psychologists remains high both in our district as well as the county, state, and nation. School psychologists are in high demand. That school districts begin recruiting students during their final year of schooling while completing their fieldwork assignment hours. School psychologists are key to the special education process for determining initial and continuing eligibility of students to receive special education support. Each year, our district is limited to the number of student assessments by the mere fact of limited hours. A school psychologist would be able to perform additional assessments under the direction of the district staff student psychologist. The approval of this stipend will allow us to compete for a limited human resource crucial to our district's delivery of student services. The amount of $15,000 is an average representation of other school districts on school psychologists. The school psychologist who will intern for the 2021-22 school year is a local individual who could be offered employment at the end of the year. This would be a great example of our district's efforts to recruit and employ more of our local community and tribal members in KTJUSD. I will entertain a motion to approve. Martha moves. Is there a second?
I'll second.
Debbie seconds. Discussion. All in favor, say aye.
Aye.
Opposed, nay. Unanimous, motion approved. Now the consent agenda, we approve with pulling items K, M, and Q for individual approval. I will entertain a motion to approve the consent agenda excluding those three items.
I make that motion.
Debbie moves. Is there a second?
I second.
Yes. Tom seconds. Discussion? Oh, no discussion. Excuse me. All in favor, say aye.
Aye.
Opposed, nay. Unanimous consent approved. Okay, on item K, the August 3rd board meeting minutes for approval. I have two corrections. So I will move that the August 3rd board meetings be approved with the following corrections. On number 4, Rod be changed to board. And on number 11, Holgrove was listed twice. So changing those over any other corrections to those minutes. Is there a second for my motion?
I'll second it.
Debbie seconds. All in favor, aye.
Aye.
Opposed, nay. Motion passed. On August 31st, the board meeting minutes for approval. Jerry, you have to make a motion.
I'd like to make a motion that on item M, number 2, after the E item, it says Terry White exited at 8:55. I did not exit at 8:55. I exited at 7:55 because I made an agreement that I'd leave at 8 o'clock and Fred finished up at 7:58 and I left at 8. And I left because I was ordered to leave at
Okay.
So 8 o'clock here.
8 o'clock.
Is there a second?
I second that motion.
Tom seconds. Any other, all in favor, say aye.
Aye.
Disapproval, nay. Unanimous approval. Okay, on item number 2, memorandum of understanding between Kuru Tribe and Orleans Elementary.
She's actually on Carrie's desk, and she said, let's wait, and she has some, I had some questions about the student data. I thought we were still waiting to get some more information. I don't know who's asking for it.
I will move that, since I was the one that had questions, I will move that we approve the memorandum of understanding between the Twitter Tribe and Portland's Elementary with the following changes. That in the second paragraph, instead of SUHSO school district, that it be Climate Trinity Joint Unified School District. And the second thing is with the inclusion of parental consent for so that the tribe could, that we need parental consent for the tribe to access the academic records. Is there a second?
Second that.
Debbie seconds. Any other discussion?
If you're changing it to the Confidentiality Joint Unified School District, shouldn't the superintendent's signature be on that rather than the?
Yes.
It needs a,
It has to be revised to be it has to be entered into the district, not the school. That was one of the things. So I think there's those clerical errors and definitely parent consent. I can get it cleaned up and bring it back.
okay, well, we're approving it with the corrections, so that would include the district signature, KTJUSD, and not the school district.
Anytime I'll replace it.
Okay, all in favor, say aye.
Aye.
Opposed, nay. It's unanimous approved. Who's that, Debbie?
I did.
Debbie did. Well, I did. Okay, so now we are the superintendent's board report. I can't believe why you're-
I have a written report that I submitted. I was going to add some additional information, especially in light of concerns that were issues that were brought up. I can read the report. Sure. I'm not sure. Find a second. So I have this into some sections, governance and administration. Staff from Northern Humboldt Wild Rivers School Transformation Grant are being scheduled to facilitate a board study session on building a multi-tiered system of support and how the grant can assist in the rollout in our district. We tentatively have a September 28th study session scheduled with the Northern Humboldt personnel. I'll confirm that you all can be there. I just have a piece about the organizational structure. The cabinet, which consists of the 2 assistant superintendents, myself, and the director of Indian education. District leadership is the entire classified management team, the cabinet, plus the principals. And the district safety team, which was addressed and was asked about. So the district safety team is historically has been the school nurse, the director of maintenance and operations, the school resource officer, and myself. In the absence of the school nurse, we transferred that to the cabinet who we consult with and receive information from various agencies. We had to really expand who we're getting consultation with. But the district safety team in this sense is more about the comprehensive school safety plan, emergency responses, and not specifically related to student services. This is already a little bit outdated. The legislature has put in some cleanup language to AB 130, which is the bill that requires LEAs to provide independent study. In addition to those students whose health would be put at risk by attending school for in-person instruction, There's additional language for the provision of students who are under a quarantine or isolation order. The California Department of Education is hosting webinars this and next week to clarify the updates to the legislation. Elementary staff have been extremely busy both during the summer and during the pre-service days in preparation for the rollout of the newly adopted Success for All curriculum. The board has approved stipend positions for staff to have a deeper and more extensive involvement with the curriculum so that they may serve as leads at those sites. The planned Wellness Truancy Court KTJUSD community events were postponed due to the stay-at-home order B being reinstated by the Valley Tribe. Meetings were canceled during the week of the school closure due to wildfires, and they are being rescheduled for later this month. There are 987 students enrolled as of Friday, August 27th, the third day of school. Reports from the student information systems show a daily average attendance rate of 80%. This is likely to change once several internal issues are addressed, including verifying student enrollment status, getting the updated attendance reports, and reconciling the weekly attendance. Another issue with attendance tracking is that the students who are completing schoolwork through independent study will have their daily attendance delayed by a week after teachers evaluate the work that is required to generate attendance. The process of collecting accurate data fits into the LCAP goal number 3 to develop a coordinated system of services. The other part of the cleanup, that's the newer part of the cleanup language from AB 130 is that the legislature clarified that the first 15 days of independent study are kind of like old school independent study. They do not require the they do not require the live interaction and the daily synchronous instruction, which are these engagement pieces that are required for long-term independent study students. The LCAP, the California Department of Education, accesses information about school districts through state databases, such as CalPADS, which is the California Longitudinal Pupil Achievement Data System, and the CAS portal, the California Assessment of Student Performance and Progress. These data are published on California Schools dashboard. Local metrics are not available to CDE, and they must be collected by the LEA and uploaded to the California School dashboards for these priorities to be met. These local priorities were presented to the board at the June 30th meeting and will be uploaded to the dashboard this month. We just got notification that it is open for me to put the information in. The local priorities document is included in the board packet. And I put the link to the direct link with the dashboard with KTJUSD's information. It gives information about chronic absenteeism, suspension rates, academic achievement. And so if you are able to get to a digital copy of the agenda, you can view the dashboard, which you don't look at any school in California. It's pretty neat metric. But this local part is what we need to collect the data. We did surveys, and then I will upload that. So that was as part of the Alpha Assembly. Health and safety. The COVID pandemic has dominated the conversations and planning efforts of superintendents across the county and the state. Locally, the medical clerk and school site staff have been directing their energies toward training in preparation for implementation of COVID testing across the district. We have significantly expanded our testing capacity, which will allow for increased surveillance and response testing. I've been in communication with staff from Humboldt County Public Health, who have been very supportive in giving guidance and logistical support. We have a meeting scheduled with Bureau Tri Public Health Officer, Kamau Public Health Officer, Humboldt County Public Health Nurse, and Humboldt County Public Health Officer to further coordinate COVID case response. So that meeting actually took place this morning, and we did so with the intention of looking at the flow sheets that have been referenced that community members have brought concern about, so those documents are not creations of KTJUSD, nor are they creations of the County Office of Education. They were made pretty by the County Office of Education. They are direct recommendations from Humboldt County Public Health, it references California Department of Public Health and CDC. So I met with Dr. Hoffman, Dr. Smith, and Holly Strong to see that we can have a clear communication. I've heard from staff or families that have been under quarantine orders, that sometimes they get different orders and different information. And quite frankly, public health is completely overwhelmed right now. They are asking us to do a public health service. So we have done contact tracing when we have detected positive students, and the testing increasing is really significant for people in this room that have been trained up and have their staff trained up. And what that allows us to do is add in a layer of protection that is crucial, which is to identify and exclude children or staff who are either ill or are asymptomatic and are ill. That's probably an even, more, there's a lot of importance there because people are vaccinated, could be positive, and they don't know it. So the testing is a really important part of our, one of the layers. We did not leave the meeting with our local public health officers and the senior officer of public health at the county with any specific recommendations to do anything other than what were on the flow charts. We are open. We are going to meet on either Thursday or Friday to revisit that. So that is the document that stands clear if we follow it. So I did want to address a couple of things that I've heard. There is no document that allows a student or a staff member who's tested positive to remain in school. That simply does not exist anywhere. Nor does it allow a student or a staff member to attend school if they have somebody who's positive in their house. And the very first question that we're asking is anybody in your house sick? So I've talked to Dr. Smith about having some joint messaging, like we really need, and I really appreciate how a number of you talked about working together. We need the community's help. I mean, the experience of an ill student coming to school, we were trying to put those messages out. We put it in the newspaper. Please do not come to school if you're ill. We have a limited ability to, we can detect obvious illness. I mean, Teresa's experience was pretty extreme. And so that is an operational kind of a nightmare. If families are able to do that very first step of screening their students, that's like half of, then we have such a reduction in a teacher having to face a student that, we know it has come to school ill. The last 2 weeks, we have not been in school. So any recent surges are not results of school transmission. It's impossible. We haven't been here. It's possible for school transmission. There's nobody who says that it is zero risk. We know that. That's why the principals really work to just emulate what CDPH is saying is there's no single thing you can do to prevent the spread. It has to be all of the things that you're required to do here, their start. They always push vaccinations. There's a vaccination clinic. We put information out. Dr. Smith is, jumping up and down saying, please get vaccinated. It's the way that public health is representing what we can do as adults, because kids don't have choices. Adults have choices. Kids under 12 can't be vaccinated. For us to protect our children by creating a safer space. So the flow charts as they are now do stand, and they are supported by public health. They have been vetted with our tribal public health as well. People need to follow those orders. We don't give the quarantine orders. Public health gives the quarantine orders. So if somebody is deviating from their doctor or the public health person who calls, I mean, we're really asking people, please follow those guidelines really strictly because it does put everybody at risk. We have to work as a team. We have to keep each other informed. There is no way that anybody in this room, I think, would position and say that there's us and them. We are absolutely here to provide service to our kids. And there's nobody here that I think would say there is zero risk. It's just not, it's not an achievable goal, but we can seriously use it. So that was my update. There were just a couple of statements that were made that are not accurate in terms of what the recommendations are and what we're following.
Could I have a question?
And I know that our principals have made those phone calls for close contacts.
Could I have a comment? A short
Yeah,
comment?
yeah.
I'm short, so. You got me. I have about 40 nieces and nephews and grandchildren this Christmas.
And when my granddaughter came home, who lives right by me, and she was around positive cases in school. And my concern was, why didn't we get a robocall stating that we had a positive test in the high school? I called every principal. I don't know what the protocol is. I called every principal, never got a call back. It used to be you go to teacher, principal, superintendent, and board. I called the principal in the elementary, Captain John, and the Hoopa Hawk. Never got a call back. I called the superintendent to get a meeting. I had 2 meetings set up, and you were too busy. By then, I could have had COVID and died because she was around people that was positive. So my concern is, like most of you have children that go to school here and have grandparents or aunts that they can take that COVID back to. And grandma or grandpa could die, even if the child does not have symptoms, but they could be positive. So what is the protocol here to let families know that you have a positive test in the high school so we can watch for symptoms?
So I don't know the specific case that you're talking. A lot of
3 cases.
So and what you have said is, I think we have to really consider that there are people that are asymptomatic. Generally, we find that kids don't display the same kinds of symptoms. So kids vaccinated people and children can be can transmit it. So that is, we need to, that's why we have to always be extra cautious. The high school, there's 2 ways that you're contacted. So if you were not contacted, it was not determined that your child was, it's about close contacts. We have a public health can't take the phone calls. They're asking us to make them, but they will contact you if they do through their investigation, find out that you did have a child at risk. So they took some, we have to turn some things over to public health where they go, well, they have an investigative team. And so they determined that who was exposed and who was not through their contact tracing. But what we realized was, and that Angie was doing these calls way before public health was. So that was inherited to the principal. And I know that the principals in a couple of cases were up for hours and hours until we have the contact tracing done. So that is the procedure.
But
and then
in this case that I'm talking about, no phone calls.
3 different times.
3 different times. One, and she was close contact, lunch with one of the girls, was a friend, volleyball, and another contact in the classroom.
Donna, you have suggestions for us?
I would like to have you guys, the principals, at least do a robocall thing, for every household in this community saying, we have a positive test in elementary. You don't have to say what grade, whatever. Watch for symptoms. That's all. That's all you guys can do.
That's a very good suggestion, I think.
And that's why for 2 weeks, I've been trying to get a hold of somebody or a live body on the staff to listen to me. But obviously, they're suffering from something worse than COVID because they're not alive. That's all I have to say. You gotta save lives here. We're losing people, our elders.
I like.
It could be you. You have children.
I have teachers in the school too. I like your
So do we.
suggestion, the robocall. That's a very positive.
I always say, I went to school for 7 damn years. Don't you guys have paper behind you that you're supposed to be a little smarter than me? And you can't figure that out? Sorry. But sometimes the uneducated people, I guess, have to educate you, educated people.
Thank you, Donna.
So that's all I have to say. When I
Thank
call to the principals, I don't even know who they are anymore. They can't even call me back. I can't even see them in the store to tell them to go to hell or something.
Thank you,
We're
Donna. Thank you.
helpless here.
I like your input.
The school-wide call would be really good.
Yes, I just have two other sections.
I just want to,
Personnel department,
just really quick, the school-wide call would be really good because a lot of kids are on different buses. It can't just be a classroom. Because they are on the playgrounds together, they're on the buses together.
event.
So does each site then have a safety team representative? So there should be somebody who at Hoopa Elementary who understands what's happening with that.
Yeah, all of the,
Okay.
yeah, and the principals can have designees. I mean, there's things that I just wanted to also say, it's super important to get information out. And then there's considerations of staff and student confidentiality. It's kind of a.
Well, I don't think anybody's asking for you to say this person has COVID, but I think
No.
what we're asking is that we're aware that is a COVID issue.
I mean, it is, and we're obligated, we are required to report to public health. And we have just found over time that they're less and less able to respond in a way that meets anybody's satisfaction. Nobody's happy with public health's response because they're overwhelmed. So we are really trying to get in, stay ahead of it. If it were not a school, or if we weren't us, it might be several days before there is a response from public health. So we have our leads are the principals. They are the leads. They're responsible for either doing contact tracing or specifically designating somebody who's HIPAA for training.
That was my next question is, are the principals are the designated person for COVID?
Yes.
So if they're not able to be contacted, they need to create a different system so that they can be contacted immediately.
By
Teachers who have
yeah,
students that are sick.
yes, that was a big.
So if there's a
Learning.
student who is sick in your classroom, they should have a direct line to that principal. So that maybe that principal needs to evaluate his communication.
They had kind of a task force set up last year. I do not know if it's to the same level of.
Well, it needs to be, because I think
that
that
was
this variant is unknown and we need to.
Okay, let's move on to item 11, discussion item, elementary and secondary school emergency relief. ESSER 3 funds. We have already received ESSER 1 and 2 in the past. So information, school districts, county offices of education, or charter schools collectively known as LDAs that receive elementary and secondary school emergency relief, ESSER, funds under the American Rescue Plan Act, referred to as ESSER 3 funds, are required to develop a plan for how they will use their ESSER 3 funds. In the plan, an LEA must explain how it intends to use its ESSER 3 funds to address students' academic, social, emotional, and mental health needs, as well as any opportunity gaps that existed before and were worsened by the COVID-19 pandemic. And the LEA may also use its ESSER 3 funds in other ways as detailed in the fiscal requirements section. LEA has flexibility to include community input and or actions included in other planning documents, such as the local control and accountability plan, provided that the input and actions are relevant to the LEA's plan to support students. So,
I mean, one of the main reasons for putting this on the board agenda So we have learning loss, we clearly have health and safety. And then social, emotional, and academic needs can be addressed.
So when will this be happening?
So over the next month, we'll develop
Several meetings.
several meetings, yes.
So that would be, if you have specific ideas, to forward them to the superintendent, to the board members, for all of us. Input from the community is very important. So you have a lot of ideas that I heard this evening, and I encourage you to submit your ideas that you may have for where our gaps are, what we need, and check every time.
And one of our other plans, we had so many plans. We made, so David's on the call, and it's really easy for him to do a email address that is lcap@KTJUSD. So we would have this be ESSER 3, and we'll post that on our website. There are 50 people that want to come. This room probably wouldn't work. So
Well, there's other bigger.
Yeah.
Places.
Yeah, so I can talk to the school principals and see about, hosting that people can, and I did talk, when we spoke on the phone for, we had a conversation, that was something that you had said was really valuable, like this whole doing everything in video conferencing. That doesn't give you access, is what you told me. It's
If you wanna sit there and look at that thing all night and see if you can make heads or tails out of it, then let's go that way, because I can't, and nobody can. So we need to have bodies
in person.
How much money is in the ESSER fund?
ESSER 3, I heard 3 different amounts. Do you have the total? 5 million, and it's 3 years?
5 million to be spent over 3 years.
5.5. 5.5. And with 20% of it for learning loss mitigation, and the rest we're covered within that.
Is this the one that's restricted to 10% to classified stuff?
It's 5.5 million over 3 years.
Is it, you have to spend 10% on classified stuff too on this one? Or
Not
is that a
on-
different one?
No, that's on the expanded learning, which is, and we did enhance the classified staff, professionals and instructional aides. This one has the learning loss, and a lot of things can be categorized as mitigating learning loss.
And you said 20% on that one? 20%.
Let's, so look forward to those meetings being advertised. Let's move on to, we've had reports and information. Assistant Superintendent Student Services gave a report that's in the packet. Is there anything you would like to highlight or add to your report?
What I would like to add is thank you very much for approving the intern stipend. That will be a great asset to have that person on staff this year. as we try and do a little bit of catch up.
And hopefully be able to hire a
Yes.
local person to stay with us. School site reports, Captain John had a report in the packet. Anything you want to highlight or add?
No, just thank you for reading the report. Appreciate it.
Is Jason here? Jack Norton, Witchpack, Europe, Magnet Elementary Schools had a report in their packet. Hoopa Valley High School, okay, you have anything you want to highlight or add?
No, not at this time.
Orleans, anything you would like to highlight or add?
Just that we're finding it very beneficial that we have the capacity to do the rapid tests on our site now. And we're taking advantage of that.
So for all the schools, we have those available for every school?
I'm seeing yes.
Kind of.
We did
Yeah.
in high school.
Yeah.
Yeah, in Hoopa, the wellness center is utilized, is the source for Hoopa L. I've had discussions with the principal about increasing the testing capacity there as well. We started, of course, with high school because of athletics, so it's kind of coming in stages. So it took some time to train everybody up.
So I just want to, I have a question. The other elementary schools have rapid test capability, but the largest elementary school in the district doesn't have capacity to give a rapid test.
Correct, they have access to the wellness center. We would like to recruit people to do that. That's what other school sites were able to do.
So. how
So
do we
we're
go
looking
forward
into-
on that? How do we go forward? on that?
I've had a conversation with the principal. I said, you need to identify some folks who can be involved. I mean, ultimately, we would like to be able to continue to do it at the wellness center, but I'm really concerned that there may be a need in that person, the one person who's there that tests might not be available, so it's building the.
Does the wellness center service the elementary school in all capacities or just the rapid testing?
So far, we have not done rapid testing at the elementary level at all. It's just been through athletics. We have to have permissions from families.
Yeah, we're just in
asking
day
to
two.
get
We're just
consent.
in day two.
Who does them at your school? Is it the principal or teachers? One
Well, we're in
person?
day two, but it doesn't sound like we have a plan to move forward with
Because
that.
they're not that hard. They're
Yeah.
really easy to do. I mean, the kids can do it themselves, really. You know, they're simple. I have them at my house.
It's the training that has taken a while. We have people here that could speak to the training process a little bit.
Who is
Yeah.
doing the training?
California Department of Public
So a
Health.
lot of it is online. Training that we have to go
It's a
through.
hands-on training and they actually have us in front of a computer. A number of us did it this last week when we had time. And we have to actually show them that we're doing all the parts and we hold everything up on the screen and,
I guess I just wanted to highlight that we are moving in the right direction as a district. We are moving forward with that and we're increasing our capacity to use these rapid tests.
So, and currently, so for staff, with the requirement that staff are either vaccinated or provide proof of a weekly test, we're really trying to just make so that they have access at their school site if they choose. They may say, I don't